Thank you very much, the Honourable Minister for Health, the Honourable Minister of State for Finance, Planning and Economic Development Planning, my colleague, the board member at NPA, the Executive Director, NPA, the UNFPA representative, the Executive Director, the Tabika National Referral Mental Hospital, all distinguished guests, members of the media, ladies and gentlemen, a very good morning to you all. It is my pleasure this morning as chairperson of the National Planning Authority to present the 2025 State of Uganda Population Report under the theme Mental Health, a Silent Emergency. This year's report takes a deliberate and strategic step to place mental health at the center of Uganda's development discourse. Mental health is not merely a social or medical concern. Just as the previous speakers mentioned, it's both a driver and constraint to national development. The well-being of our people is directly linked to the productivity of our workforce, the stability of our families, and the resilience of our economy. Mental health affects multiple dimensions of development. It shapes the quality of human capital, the effectiveness of service delivery, labor productivity, and the overall societal resilience. So addressing mental health, ladies and gentlemen, is very essential for building a healthy, capable, and productive population that can sustain long-term development. As the previous speakers noted, the 2025 State of Uganda Population Report shows that mental health conditions affect nearly 1 in 4 Ugandans. All of us here, I think, are affected by this virus. We either know of somebody we are caring for, or we are also partly mental. So it demonstrates really that the economic cost of mental illness is rising, largely through lost productivity. These findings confirm that mental health is not a marginal issue. Yet there remains a clear mismatch between the need and investment. So ladies and gentlemen, this reality calls for a deliberate shift in how mental health is prioritized, is financed within our national systems. And I think having this report at this critical time is very timely. I think all of us need to galvanize our interests, our efforts, and see that we make a difference. We cannot go on as business as usual. When citizens are mentally healthy, they remain in school, perform effectively at work, support their families, and contribute meaningfully to national progress. The returns on mental health investment extend far beyond the health sector. Mental health must, therefore, be understood within Uganda's broader development framework, the 10-fold growth strategy, the 4th National Development Plan, and Uganda's Vision 2040, which all place people at the center of transformation. We need very able, very clear focus, very mentally alert Ugandans to get the 10-fold growth. However, a population weighed down by mental distress cannot fully participate in economic growth. Unlocking this potential of our people, therefore, requires deliberate attention to mental well-being. So it's against this backdrop, ladies and gentlemen, that the 2025 report adopts a life course and systems approach. It examines how mental health risks and outcomes evolve from early childhood through youth transitions, working life, and old age, and how these experiences interact with education, employment, urbanization, and social protection systems. So distinguished ladies and gentlemen, by moving beyond a narrow facility-based view, this report positions mental health as a population-wide development concern. It highlights the social-economic drivers of mental health and illness, quantifies the human and economic costs of inaction, and assesses the readiness of Uganda's health and social systems to respond. And in bringing these elements together, the report really provides an integrated evidence base to guide policy, planning, and investment. We must act now. We have the data, we have the information, and we could and must get it right. And as the National Planning Authority, we will continue working very closely with the Minister of Health, and I'm very pleased, Honorable, that you're here. Let's work together and get this done. The Ministry of Finance, Planning, and Economic Development, my Honorable Minister is here. We have to do it differently. Development partners, UNFPA, you're here. All civil society development partners, private sector, the media, let's decide deliberately, intentionally to do it differently. We must act now. We will advocate for strong prioritization of mental health across development programs and support its integration into national and subnational planning processes. The passionate director for mental health at the Tabika has passionately appealed to the country, to the minister. Let us rally behind her and the ministry and really act and address the issue of mental health in this country. I call upon government across all the institutions, all our development partners, all of civil society, the private sector, once again the media, and the entire communities to engage with the findings that we've provided in the report and act with urgency and coordination. We must strengthen prevention and early intervention, expand access to quality services, increase resources for mental health, and address the stigma that prevents many from seeking care. In doing so, we will protect Uganda's human capital and strengthen national productivity.